Hello everyone. So now we'll be discussing the management of osteoradionecrosis, that is HBO therapy. So osteoradionecrosis, which we all know, there are three H: hypoxia, hypocellularity and hypovascularity. So because of the deficiency of 3H, it results in compromised blood supply and the bone is getting necrosed. So the bone is getting avascularized, dead and degenerated it is becoming. So we have to treat these conditions. So the management or the treatment of osteoradionecrosis is HBO therapy. So this HBO therapy, here a lot of MCQs are asked. Here they ask what is the unit of HBO therapy, that is dive, and what is one dive, that you should know, what all special things you give in HBO chamber, that you should know. And then these patients, when we are giving HBO therapy, they go from stage 1 to stage 2 to stage 3 and they go up to reconstruction phase. So how many dives are given, what is stage 1, stage 2, stage 3, we should know. A lot of MCQs are generated there, and then we should know this HBO therapy, where it is indicated and where it is contraindicated. So with this basic background, let us start HBO therapy. So coming to the first one, that is HBO therapy. So patient developed this problem, that is osteoradionecrosis. So now what we are saying is the atmospheric pressure 1. So in this atmospheric pressure 1, the patient developed this condition. So we have to treat him at a different atmospheric pressure. So we take the patient to a special room, that is HBO chamber, right? So that special room will have atmospheric pressure greater than 1. Our normal atmospheric pressure in our room is 1 right now. So greater than 1. So we take the patient to a greater atmospheric pressure, that is 2.4. So this is one MCQ. What is the atmospheric pressure in HBO chamber? 2.4. Okay. And now we are inhaling oxygen. So out of mixture of gases, some 19 to 20% is oxygen, 71% is nitrogen. So this 19 to 20% oxygen what we are inhaling, and this patient, by inhaling 19 to 20% of oxygen, he developed osteoradionecrosis. So we are taking this patient to a new chamber where we give 5 times more the oxygen. 19 to 20% he was inhaling earlier, now we give him 100% humidified oxygen. So this is different. First of all, the atmospheric pressure of the room is changed to 2.4 and the oxygen with the hood or the mask what he is taking is 100%. So 5 times more than the normal. So there will be the flood of oxygen, a tsunami of oxygen will take place inside the body. It will go inside. So this patient is placed in a chamber, oxygen is given by a mask and 90 minutes in length, 90 minutes. So patient will be sitting or sleeping, mask is kept, the room is 2.4 atmospheric pressure and then 100% humidified oxygen for 90 minutes. So this three parameters, number 1, 100% oxygen, 2.4 atmospheric pressure, 90 minutes in length is DIVE, D-I-V-E. Dive is a unit of HBO therapy. So this is one dive we call it, right? So the treatment is given 5 days per week. So the patient will be coming on a weekly basis, Monday to Friday you make it, something like that, 5 days per week, and he will be given this doses, 30 dives, 60 dives or something like that, and the treatment will be continued, right? So he will come 5 days, so dives will be given whatever you can give on that day, 90 minutes, and then again next week he will come, the next week he will come, like that it will go on. So for 5 days per week only we will be giving. So it will be done at 2.4 atmospheric pressure. Yes. And what will happen? This is used for the treatment of number 1 osteomyelitis and number 2 osteoradionecrosis. So HBO therapy has a wonderful results in osteomyelitis, bone medullary inflammation of the bone, and osteoradionecrosis. These two condition it is. So your MCQ is, what is DIVE? What do you mean by DIVE? So one dive is equal to 90 minutes, 2.4 atmospheric pressure, and then 100% oxygen. So when you are giving an oxygen concentration 100%, so the tissue oxygen tension will rise to 150 to 250 mm of Hg, which is extremely high. And then this elevation will quickly results to hypoxic level. So it is given and suddenly it will be taken back. So it will rise up to 150 to 250 and then it will come back to 10 to 15. So it is just like a fluctuation, like our electricity fluctuation happens. It will boost up and it will stop. A spark comes and it stops. So by this repeatedly doing, what happens, by giving this oxygen, it will stimulate the cells which are not completely dead, half dead cells or going to die or something. They just get the new life, they just get the energy because of this stimulation. So the intermittent rise in oxygen level is adequate to stimulate, number one, fibroblast collagen production. Fibroblast collagen production it will stimulate. Then vascular proliferation and new cellularity of the wound. So wherever there is a wound, the new cells will come. So please remember, the fibrogen collagen production will increase because of the stimulation of the oxygen. So once this oxygen is given, increases in arterial and oxygen tension happens. Then bacteriostatic effect on the microorganism will happen. So as a result, whatever, these three things will happen. Neoangiogenesis, new blood vessels will be formed because of the stimulation by oxygen. Then fibroblastic proliferation will happen and then collagen synthesis will occur. So neoangiogenesis, fibroblastic proliferation, collagen synthesis will happen. So these three things will happen and the patient will recover. So this is the basis of HBO therapy. Now, while giving the HBO protocols, whenever you are giving this treatment, so there is one protocol we need to follow, and the protocol is called as Mark's protocol. Very important. So many questions are asked from here. You should learn this properly. Okay, I'll try to explain this in a new way. Okay, so whenever we go to a marriage function, anything, so what do you get first? Whenever we go, we get a welcome drink. Before meeting the bride and groom, we get a welcome drink. So here in the Mark's protocol also, there is a welcome drink. And here the drink is DIVE. DIVE. This is our unit. So now stage 1, you can see here there is something called stage 1, stage 2, stage 3, stage 3R. In every stage, your quota is fixed. You are supposed to get 60 dives. In stage 1, 60 dives only you will get maximum. Stage 2, 60 dives. Stage 3, 60. Like that only. Nothing more than that. Okay. So now stage 1. So patient is diagnosed with osteomyelitis or osteoradionecrosis and he has to undergo HBO therapy. So stage 1. So as I told you, marriage functions when we go, welcome drink. So here total is 60. In stage 1 we will give you 60. But once you come, a welcome dose of 6 out of 60, 30 dives are given. So in every stage, 30 dive is the welcome drink, you can call it. Something like that. So in stage 1, first 30 dives are given. You can see here 30 dives are given. So and patient is sent back home. He is again recalled back and then you re-evaluate what happened to that area. There was necrose, pus was coming, the bone was degenerated. After giving this 30 dives, what happened? If the patient recovers or lot of good signs of recovery is taking place, then it's a good sign. Only 30 dives you have given in stage 1, 30 is more balance. So patient is recovering. You give his balance 30 more dives, you give this HBO therapy to the patient, send back home, that is the end of the treatment. So 30 was welcome drink and 30 now 60 dives over, treatment finish. For those patients whose improvement were seen. But if after the initial 30 dives, if improvement was not seen, what to do now? So then, okay, fine, improvement is not seen, the lesion is same like that. pus is coming, bone is not healed, 30 dives over. Okay, fine. You take the remaining 30 first. Don't worry. Come to stage 2. So from stage 1, now you have come to stage 2 because nothing happened even after 30 plus 30, 60 dives over, patient no improvement. So welcome to stage 2, welcome drink, you take 30 dives and do this procedure called sequestrectomy and primary closure is done. Sequestrectomy, what is sequestrum? That is dead and degenerated bone. So whatever pus degenerated bone with your burrs and all, take it out, scoop it out. Induce a fresh bleeding, make it healthy bleeding, and then do a primary closure. First 30 dives you give, perform sequestrectomy and primary closure, send the patient home, recall him after certain period of time, right? And then you give his, see what is the improvement. If improvement is seen after sequestrectomy and wound closure, very good. So your balance only first 30 was given, you take remaining 30. So good, and then you can go home permanently. Your treatment is over. But after the initial 30 days, sequestrectomy is done, primary closure is done, and still not healing. So then this condition is not good. You come to stage 3. So stage 3, again welcome drink, you give 30 dives. And then the part of the bone which after sequestrectomy also it was not healing, you just cut that part, that is resection. So resection to bleeding is done. You just cut and throw that waste part and induce fresh bleeding. And then you give remaining 30 dives to make it total of 60 dives. So now one part is cut. Suppose one part, half of the mandible is cut and thrown. So you cannot leave the patient like that. First let it heal, recall the patient, and then you do reconstruction. R for reconstruction. R for reconstruction. So in this stage 3R, again welcome drink is 30 dives. So this 30 dives we will break into 10 plus 20. 30 is 10 plus 20. So 10 weeks after the resection is done, patient is given 20 dives. And then we do the reconstruction plate, whatever is to be done, we will do that. 20 dives we have given. After the reconstruction plate, give 10 more. So 30 dives it becomes. So in the stage 3R, the total is only 30 dives. So what I am trying to tell you is, here is 60 dives, stage 1, stage 2 60, stage 3 60, stage 3R 30 dives. So this is the overall treatment of the osteoradionecrosis, that is HPO, Mark's protocol. This is this philosophy called Mark's protocol. Okay, so I hope you all understood this well. A lot of MCQs are generated from the stage 1, how many dives, what procedure is done, something like that. So coming to contraindications of HPO therapy, where all you should not do. You should not give in pneumothorax patients, optic neuritis, inflammations of the eye, and acute viral infections. It is contraindicated. Viral infection is going on, you should not give HPO therapy. Not only this, we should not give in upper respiratory infections also. And then congenital spirocytosis you should not give, active tumor cells also you should not give. So in these 3 or 4 conditions, you are not supposed to do HPO therapy. So, okay, let us solve an MCQ. Hyperbaric oxygen is contraindicated in all except, so where we give, okay. So please remember, generally HPO therapy is very effective in the treatment of problems related with eye, not optic neuritis but other conditions. Please remember that. So it is the treatment of choice. Spirocytosis, just now we have done, we discussed that. It is contraindicated. Recurrence of tumor contraindicated. Thalassemia also contraindicated. Blood related. Glaucoma. So that is the answer here. So please remember, it is the treatment of choice in glaucoma. It was found that HBO therapy used in glaucoma is a significant, there will be improvement in the visual acuity. The patient can visual fields, he can see more properly in the glaucoma. And no influence on ocular pressure will be there. So the glaucoma can be solved very beautifully here. So the answer is 2, that is glaucoma. It is not contraindicated. Okay. So coming to the explanations, something for that. It improves the visual acuity and reduces the blindness caused by lack of oxygen, because you're stimulating and you're giving oxygen. So it improves the retinal blood flow also, eye retinal blood flow, it will increase, reduces the scar formation after surgery also. So scar formations anywhere, HBO therapy, because oxygen is surplus. So it's really great over there. Then hyperbaric oxygen therapy is used in eye complications also to treat a lot of problems in the eye. Like HBO therapy suppresses infection either directly by destroying the bacteria. It will just flush out the bacteria. It improves the immune system response and it enhances the effects of some antibiotics also. So this is in eye complications. HBO therapy is a boon. So HBO therapy is, in a nutshell, it is a treatment of osteoradionecrosis, osteomyelitis, and eye related problems also. It's a boon there. So you should know what is one dive. The numbers: 100% oxygen, 2.4 atmospheric pressure, and then 90 minutes duration is one dive. You should know that. And then there will be fibrogen and collagen synthesis will be there, new angiogenesis will take place because of this. And then Mars protocol, stage 1, stage 2, stage 3, stage 3R. You should be knowing that each stage how much dives are given, you should be knowing, and the indications and contraindications of HBO therapy. So that's all in HBO therapy. Thank you.